Hello dear friends, how are you doing today? I hope you are doing well. Today we are going to talk about angioma or cherry angioma. Definition: an angioma is a common benign vascular growth in older adults. It is also referred to as cherry angioma because of its bright red color. Angioma, bright red pinpoint macules and papules. Epidermis is usually normal, and in dermis we can see well demarcated collection of blood vessels. Incidence: angiomas are very common and increase in number as one ages. Virtually all elderly individuals have angiomas. History: angiomas are frequently an incidental finding on the skin examination. They are asymptomatic unless traumatized. Occasionally, the patient or physician is concerned that an angioma may be a melanoma if it is deep purple in color, as we can see here in this photo. Physical examination: angiomas are easily recognized by their smooth surface and red color. There may be a few to numerous angiomas occurring most commonly on the trunk but can be on the head and extremities. They vary from being pinpoint macules resembling petechia to papules or small plaques. Angiomas usually are bright red but may be shades of deep red to purple. Differential diagnosis: an angioma is easily recognized most of the time. Petechia are sometimes confused with numerous small flat angiomas. The occurrence on the trunk and the presence for years in a healthy individual makes angioma the diagnosis. When deep purple, a blue nevus or melanoma should be considered. Examination with the dermatoscope is very helpful in visualizing the vascular globules seen in an angioma. If uncertain, a biopsy should be performed. Laboratory and biopsy: the diagnosis of angioma is almost always made clinically. If in doubt, a biopsy reveals a well-demarcated collection of small blood vessels in the dermis. Therapy: in most cases, no therapy is needed. If irritated or cosmetically unattractive to the patient, they can be shaved off, electrodesiccated, or lasered. The conclusion of therapy for angioma: as we said, no need therapy for most cases. Shave, biopsy, electrodesiccation, and lasers are the choices for treatment. Course and complications: the number of angiomas increases with age. They are usually of no concern other than for their cosmetic appearance. They are chronic and not associated with complications other than bleeding if traumatized. Clinical case: a 56-year-old man presents for a routine skin check. He is concerned about several small red spots on his trunk that have gradually increased in number over the past few years. The lesions do not bleed, are painless, and have not changed in size rapidly. On examination, multiple bright red to violaceous dome-shaped papules measuring 2 to 5 mm are scattered across the chest and abdomen. Gentle pressure with a glass slide causes them to blanch. No signs of ulceration or inflammation are present. Which of the following is the most likely diagnosis? A. Hemangioma. B. Cherry angioma. C. Kaposi sarcoma. D. Pyogenic granuloma. And E. Petechia. According to our explanations, the correct answer is cherry angioma or angioma. Explanation: cherry angiomas or senile angiomas are very common benign vascular lesions. Appear as small red dome-shaped papules, common in adults over 40, often increase with age, blanch with pressure, and are usually located on trunk and upper extremities. Differential diagnosis: hemangioma typically appears in infants and may be larger and rise. Kaposi sarcoma is violaceous plaques or nodules, often in immunocompromised patients, and do not blanch fully. And pyogenic granuloma are rapidly growing red nodules that bleeds easily. Petechia is non-bleaching pinpoint red spots due to bleeding under skin. Okay, this was an explanation about angioma or cherry angioma. Thank you for your attention.